This topic is Alzheimer disease. Alzheimer disease is an irreversible and progressive form of dementia. It's important to note that the word dementia itself describes a number of conditions that result in loss of cognitive function that leads to memory impairment. Alzheimer disease is caused by neurodegenerative changes within the brain, and these changes are brought on by an abnormal amount of protein buildup. There are two types of proteins that can cause these abnormal changes within the brain. The first is beta amyloid proteins. Now, these proteins, when they deposit within the brain tissue, normally they are eliminated by the immune response. Essentially, the body recognizes this abnormal deposit and will send white blood cells and macrophages to digest that protein and eliminate it from the tissue. However, when these proteins clump together, they form plaques. Most of the time, these plaques remain deposited within the tissue, and the inflammatory response that is generated to try and remove these plaques results in cell damage and neuronal death. The other type of protein that can lead to the development of Alzheimer disease is the tau protein. Now, instead of depositing outside of the neuron cell like beta amyloid proteins, this protein will deposit inside the neuron itself. As these tau proteins accumulate within the neuron, it will disrupt normal neuronal function and also result in neuron death. It's important to remember that communication between the neurons is how the brain actually functions and works. When we have a loss of communication between these neurons, this is what leads to abnormal brain function. For example, let's say we have 3 neurons. If neuron 1 normally communicates to neuron 2, which communicates to neuron number 3, and suddenly we lose neuron number 2, it's going to be much harder for neuron 1 to communicate to neuron 3, or that communication may not happen at all. The development of Alzheimer's disease is likely due to a combination of genetic and environmental factors. So individuals with a family history or who are genetically predisposed to this type of condition, as well as individuals who are not keeping up with their chronic conditions or living what would be determined as an unhealthy lifestyle, are more likely to develop the disease. However, if an individual is generally eating healthy, is managing any chronic conditions like diabetes, meaning they're keeping their blood sugar in check, or hypertension, meaning they're keeping their blood pressure down, this is more likely to reduce the risk. The overall impacts of these neurodegenerative changes within the brain are a decrease in cognitive function, as well as changes within the client's language and reasoning skills. With Alzheimer's disease, changes within the brain develop over time. Therefore, the manifestations for this client can vary depending on whether the client is in early stages of Alzheimer's disease versus late stages of Alzheimer's disease. Early findings include a decline in short-term memory and social skills. So oftentimes you may be talking to this client about what they were eating for breakfast, and they may not be able to recall what they had. Clients may have visuospatial deficits. An example of this is if the client were to go to someplace familiar like the grocery store, and on their way home, they realize that they have become lost. Language difficulties may occur, meaning that the client may forget words or have trouble remembering them. Beyond developing complications with short-term memory, other forms of cognitive impairment include an inability to focus on a task or an ability to learn a new skill. And because of this, clients can develop self-care deficits. For instance, they begin to have issues with personal grooming, and they may find it difficult to dress themselves. For instance, you may notice that they have difficulty when it comes to buttoning a shirt. As cognitive function declines over time, we may be able to see some behavioral changes develop in these clients. Late findings include neuropsychiatric symptoms such as hallucinations or delusions. Non-cognitive neurological deficits may result. These are things like changes in emotion, the client may be more depressed or anxious, or they may be more irritable or angry. Because of this impaired communication of neurons within the brain, the client can develop extrapyramidal symptoms, myoclonus, which is muscle twitching, and are at risk for the development of seizures. Over time, the brain cells are shrinking and losing function, so we often see that the clients may lose bladder or bowel function on top of everything else that they're experiencing. There is no specific diagnostic test when it comes to confirming whether or not an individual has Alzheimer's disease. Usually, the healthcare provider will choose to rule out other disease processes that cause memory loss issues in order to form the diagnosis of Alzheimer's disease. One diagnostic tool that can be used to visualize for changes brought on by Alzheimer's disease is the use of an MRI. As the brain tissue is scanned, the healthcare provider is going to look for any diffuse atrophy of the brain tissue. And other causes will be ruled out. So for things that cause a decreased metabolism or decreased cognitive function, like hypothyroidism, B12 deficiency, and depression, the healthcare provider will make sure to screen the client for these before diagnosing them with Alzheimer's disease. When it comes to taking care of these clients, one of the first things that we want to do and continue throughout their care is to perform cognitive assessments. Now, we can use formal tools like the mini mental state examination or the Montreal Cognitive Assessment, both of which use a series of questions to determine the client's overall cognitive function. These examinations are examples of what you may need to use at the bedside or when caring for the client. Other ways that we can monitor cognitive function is by checking the client's level of orientation, attention to detail, and the ability to recall specific information. For instance, one of the most common assessments we do at the bedside is to check the client's level of orientation. We can ask questions to see if they're oriented to themselves or the situation, as well as if they're oriented to the place that they're in or what time it is. And an initial assessment of the client's cognitive function helps us to establish a baseline so that we know if they have further declines in cognitive function as they move forward. One of the primary medication types that these clients receive are going to be cholinesterase inhibitors. Now, cholinesterase is an enzyme that breaks down acetylcholine within the body. So if we give a cholinesterase inhibitor, this increases the amount of available acetylcholine. By increasing acetylcholine, which is a neurotransmitter, we are attempting to increase communication between the neurons within the brain. And these medications include donepezil and rivastigmine. Another type of medication that we might give would be an N-methyl D-aspartate or NMDA receptor antagonist, such as memantine. This medication is given along with cholinesterase inhibitors in order to help retain cognitive function. As the disease process worsens the client's cognitive abilities, it may be important to designate someone to administer the medication to the client or to request that medications be provided in a patch form. In this way, it's more likely for the client to adhere to the medication regimen, which will help to decrease the decline in function. Early on in the disease process, when the client still is oriented and is able to make decisions, it's important that the client anticipate any future issues that may arise due to their inability to make decisions. So resolving legal issues now will be important as the client becomes unable to make decisions for themselves. This includes the generation of a living will, assigning a medical power of attorney, and determining what to do at the client's end of life. Throughout the disease process, it's important that the client is provided with a structured and consistent daily routine. Any new information that the client has to process or any deviation from a structured plan can result in frustration for the client, which can lead to irritability and anger issues. Another way that we can promote the client's well-being is by establishing a normal daytime and nighttime cycle. Some ways we can do this is by decreasing stimulation, especially in the afternoons and evenings. So we want to avoid things like caffeine as well as watching TV at later hours. We want to increase the client's exposure to daytime light. So if we can get them outside safely, that's a great idea. Or we can make sure that we open windows and allow natural sunlight to come in. Throughout the day, we want to make sure that we're reorienting the client so that they know what time it is and what day it is. And we want to help establish a normal sleep cycle for them so they're getting enough rest, which is going to help promote their overall well-being. There are a number of safety interventions that we should consider. For one, we can use a door sensor. By doing this, we know if a client is attempting to use a door, and we can escort them wherever they're trying to get to or bring them back to a safe environment. Clients with Alzheimer's disease can become restless and tend to wander. And when they begin to do so, we want to establish a safe place where they can do this. It's important that these clients wear a medical identification bracelet in case they do get lost. And we need to encourage elimination of certain household hazards. This can be things like gas appliances. Throw rugs become a tripping hazard for these clients. Toxic chemicals should be stored securely or thrown away. And the installation of grab bars can help these clients in the shower and the bathroom. Now, while we've talked a lot about caring for the client with Alzheimer's disease, it's important that we address the caregiver's burden. For family or friends who are caring for an individual with Alzheimer's disease, they can become very exhausted, especially over time. We may need to encourage them to use respite care or long-term care in order to get a break from caregiver responsibilities. Additionally, they can join support groups to help deal with some of the emotional toil. Regardless of the type of care that the client is actually receiving, it's important that the nurse screen and check for mistreatment or neglect by the caregiver. Neuropsychiatric symptoms with Alzheimer's disease can include hallucinations, delusions, and aggression. Now, it's very important that if a client is experiencing any of these, we do not want to negate their experience. We do, however, want to continually establish reality and reorient the client. This includes assuring the client that they are safe, using forms of distraction like the use of familiar music or photographs. We may need to give simple directions to the client so it's easier for them to follow what we're asking them to do. For communication purposes, we should stand near the client, make sure we're making eye contact with them, and we may need to use visual cues and gestures. And again, because significant cognitive function can develop, we do not want to challenge these clients' delusions, as they can become frustrated, irritable, and angry, and may lash out at staff.